Recording. Okay. Ladies and gentlemen, we're live. We're having a note from the production booth right now that we're about to start the show. Are y'all ready? Okay. Yes, Kara, keep counting. Keep counting, and we'll go on your count, Kara. So, perfect. Hello, and welcome to the Mid-Level Show. We are the mid-levels of performance medicine representing East Tennessee right now. Nurse practitioners in the house representing, as well as physician's assistants. I'm Andy, I'm hosting. And each week we go over the doctor's note from Papa Doc. Papa Doc's not a good name, right? Isn't that kind of like, there's some sort of bad person called Papa Doc, right? I'm getting a note from production. I think that is. I don't think we're allowed to use that name. He said that when he becomes a grandparent, he wants to either be called Doc or Papa Doc, but I don't know. The supervising physician is my dad, Dr. Rogers, and each week we go over his doctor's note, and this one is on hair loss in women, hair loss in females, which I don't know about you all. I get this question a lot in the room. What about you guys? Do you get this question a lot? Absolutely. Yep. Hold on one second. I need a note from production. We are muted right now. Note from production. We're muted right now. So let's go to our full screen. Are you? Can I get a test from everybody?
Yes. Hello.
And Fran?
Hello. Hi.
Okay, we're in. Never mind. We're good. No, we're good. No.
There was no mute. I think we were trying to be respectful and let whichever woman wanted to start.
I was about to say, I couldn't hear anything, so maybe that was it. Y'all are being very respectful of each other's time, but I would love for y'all to chime in now and see. You all do get this. I get this question quite a bit. My hair, I'm losing my hair. What is the first thing that you all do when that happens in the room with the question, I'm losing my hair? I will go with Kara. What do you think? Kara's representing Knoxville.
I ask them about thyroid disease, if they have any history of that. That's probably the first thing that comes to mind.
That's great. Thyroid's perfect. And I feel like that's such a, that's such a good one to just knock off the list. Like, hey, do you have any of these other thyroid symptoms? Do you have problems with your bowel movements? Are you tired all the time? Do you have weight retention? If you click a couple of those boxes, then maybe we haven't investigated thyroid. Amber, what about you? What are some of the first questions that you start asking too?
If their biggest thing is my hair's coming out, I normally ask, okay, well, is there anything else? Like get a picture of their history, their reproductive history. Did they have a baby recently? Are they going through menopause? Are there any other hormonal changes that they've noticed? My hair, that's maybe their biggest thing. Maybe I have lower energy. Maybe my hands are really dry that I didn't notice. Or, you start asking them some more questions to get a more full picture of any other symptoms that might be going on as well.
I like that. It's almost like what else can be contributing right now? And you picked up a lot on hormones too. That's the first thing out of the doctor's note is a lot of this is with hormones. So often with women in perimenopause or menopause or just having a baby, an influx or a decrease in hormones can cause hair thinning or hair loss. Fran, what are some of the things that you think about whenever a patient asks you that?
I always like to focus on their diet, find out, have they lost a lot of weight recently? Have there been big stress changes? All the things that affect your hormones, and find out, did a parent just pass away? I mean, have they been going through incredible amounts of stress? Just look at the whole picture. Has this ever happened before? And if it did, like if you're an older woman, did this happen when you had your babies? And that kind of would make you think maybe this is hormonal for you. If they've never had that problem before, you might start thinking it's something else must be going on. And then I would probably want to get some lab work.
I think that's such a nice thing.
Performance medicine offers so many great things.
Oh yeah, and true. It's you hit on a really great thing that
respect
it's not.
Respect your cell. Look at their vitamin. Different events you can look at.
I feel like there's so much with we've hit on hormones, we've hit on thyroid, but also just like the natural stuff, stress, have you been stressed out recently? That causes hair loss too. And so often we just kind of neglect that part of it too, just with stress and what might be happening naturally in the home that we're not thinking about. There's a lot of causes that Dr. Rogers has listed on here, including anemia, stress, eating disorders, vitamin and mineral deficiencies too, which we test for at the office with SpectraCell labs, protein deficiencies, hypothyroid, birth control, steroids, autoimmune disease, PCOS. The list feels like it goes on and can be exhaustive. I feel like what I took out most out of this was just the amount of emotional stress that this can cause. I actually just had a patient who was talking about her son with hair loss and just kind of like the amount of like, it's almost like a taboo subject to talk about the bald spot, but then they make fun of the bald spot. It's just kind of a weird spot to be in. I don't know if y'all have come encounter that it's a lot of it's psychological. Do y'all feel like you come encounter with that too? It's like they become embarrassed to talk about it. They're worried. Yeah. Everybody,
yeah. Well, there was the one.
Everybody
I had
agrees.
A patient.
Nobody wants to talk about hair loss today. Okay, nobody wants it. Once you talk about it, then it falls out, right?